Hi, everybody. My name is Brittany Wormley, and I decided to do this assignment on child abuse and neglect in rural areas. I chose this topic because I am a child welfare worker, but I am a CAN investigator in an urban area, and I thought it'd be interesting to find out some facts about child abuse and neglect in rural areas. Um, I started out with the definitions of what rural and urban is. According to the U.S. Census Bureau, anything that is not urban is labeled as rural. So, by definition, urban is defined as either urbanized areas of 50,000 or more, or urban clusters between 2,500 and 49,999 people that have population densities exceeding 1,000 people per square mile. Rural is defined as non-metropolitan areas as those that include some combination of open countryside, places with a population less than 2,500, or urban areas with populations between 2,500 and 49,999 that are not a part of a larger labor market in a metropolitan area. Statistics show that almost one-fifth of the U.S. population lives in rural areas spread out over communities encompassing between 72 and 95% of the U.S. land area. That statistic was provided by the U.S. Department of Health and Human Services. So each state has its own definition of what is considered child abuse and neglect, but the federal definition is that at a minimum, any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or sexual exploitation, or an act or failure to act which presents an imminent risk of serious harm. The state of Alabama defines child abuse as harm or threatened harm to a child's health or welfare, which can occur through non accidental physical or mental injury, sexual abuse or attempted sexual abuse, sexual exploitation or attempted sexual exploitation. Under the state law, neglect is defined as negligent treatment or maltreatment of a child, including the failure to provide adequate food, medical treatment, clothing, or shelter. Provided, however, that a parent or guardian legitimately practicing his religious beliefs who thereby does not provide specified medical treatment for a child. However, the court can order that medical services be provided to the child where his health requires it. Excuse me. So what that means is that a parent can have legitimate religious beliefs that prevent them from providing a particular set of medical care to their child. But if a judge deems it necessary, then that court order by that judge would trump the parent say so. In Alabama, child abuse is the number 8 health concern. According to the U.S. Department of Health and Human Services, in 2015, Alabama had 22,067 total referrals for child abuse and neglect. According to the Alabama Department of Public Health, the rate of reported cases has been relatively steady at a rate of less than 19 cases per 1,000 children. The rate of reported cases for rural counties is slightly higher than the rate of reported cases for urban counties, with that rate being 19.8% in rural areas versus 17.5% in urban areas. A study conducted by the Fourth National Incidence Study of Child Abuse and Neglect found that the rate of abuse for children in rural areas was 1.7 times higher than that for children in major urban areas. Emotional neglect among kids living in rural counties is higher than for children living in urban counties. Children in rural counties were 2.8 times more likely to be physically neglected than children in major urban counties and 2.2 times more likely than urban children. The rate of sexual abuse in rural counties also exceeded twice as much the rate in major urban counties. So what those statistics stated to me was that there are more incidences of child abuse and neglect in rural areas than there are in urban areas. That study also provided a chart of the difference between rural, urban, and major urban areas. In total, rural areas still took precedence with the most accounts of abuse. Another study was conducted by the Health and Well-Being of Children in Rural Areas that listed that 8.9% of rural children have been victims or witnesses to neighborhood violence, compared to 8.6% in urban areas. 9.9% of children in small rural communities have witnessed domestic violence versus 6.8% in rural settings. Over 60% of rural caregivers reported for child maltreatment experienced high family stress, compared to 50% in urban areas. Neglect makes up 46% of all reported rural cases, compared to 28% for physical abuse and 14% for sexual abuse. And more than a quarter of reported child abuse cases in both rural and urban locations include more than one type of maltreatment. There were several challenges that were prevalent in rural communities versus the urban counterparts, with poverty being one of the biggest issues, which then begged the question of what is poverty and what is actual neglect. Um, the definition of poverty is defined as having an income below the poverty threshold, with the poverty line in 2017 for an individual under 65 years old being $12,752. A three-person family, that's two adults and one child, is $19,730. And a five-person family, two adults, three kids, with $29,253. And the average family size in 2019 is 2.6 people. Studies have shown that in 2018 in the US, 11.8% of the population lived in poverty, with 5.6% of those people living in deep poverty, which is considered having an income less than 50% of the poverty threshold. The areas in which poverty exists are concentrated and clustered in specific regions, and higher instances of poverty seem to be experienced by people who live in rural or non-metropolitan areas. This is likely due to the lack of available resources in those rural areas, which leads to higher crime rates, health-related issues, and educational issues. So that says that, are they actually neglecting their children, or can they just not afford to properly care for them? In 2018, 16.2% of all children lived in poverty in the U.S. That's about one in every six kids. 18% of the population in Alabama lives in poverty. 26% of that number are Alabama's children. And 22.8% of rural children in the U.S. were poor, compared to 17.7% of urban children. At the county level, on average, there were 43 counties in the whole United States with child poverty rates of 50% or higher. 40 of which were rural counties in the South. Another challenge that affects child abuse rates in rural areas are lack of education and lack of employment opportunities. In Alabama, 69 of 130 total school districts are considered rural by the National Center for Education Statistics. Alabama has the country's lowest test scores for fourth grade math and the second lowest in eighth grade math. In 2018, the rural unemployment rate was 4.2% compared to the urban rate of 3.9%. Although those rates are low, child abuse and maltreatment occurs at a rate of 2 to 3 times higher for kids with parents who are unemployed compared to those with parents in the workforce. There is a foundation called the Annie E. Casey Foundation that exists to combine the education and employment needs in rural areas. The program includes providing stable employment, high quality childcare, and early education, along with quality elementary schools and education and support to families through a home visiting program. Because education appears to be the least of our concern in Alabama, a lot of kids in rural areas aren't being pushed. They're not getting the education that they need, which results in poor employment, which again leads to further poverty, um, which in turn adds to more abused and neglected children. Substance abuse is another issue that is heavy in the rural areas. The adoption and foster care analysis and reporting system revealed that 38% of child removals nationwide were factored due to parental alcohol or drug use in 2015. As substance abuse relates to child abuse, it happens if a child is exposed prenatally due to the mother's use of legal or illegal drugs or other substances. Methamphetamine is manufactured in the presence of a child. Selling, distributing, or giving illegal drugs or alcohol to a child, or if a parent or caregiver uses a controlled substance that impairs their ability to adequately care for the child. What are some options that us as social workers can do to help? We can assist with employment and vocational training, increased awareness of the rates, counseling services for all of our families, violence prevention programs that are in clinical settings as well as community settings, awareness campaigns that promote prevention and intervention, anti-bullying and mentoring programs in school, transportation options, housing options, and child care and Head Start options. Uh, as workers that will be in rural areas, to best serve the community, we must cultivate community connections, draw from our personal knowledge of the local setting and the culture, and rely on relevant evidence based practices. We must be properly trained, prepared, and understanding of life in rural communities. We have to understand the idea of confidentiality, boundaries, and professionalism must remain on the forefront. We must be willing to garner reciprocal and collaborative relationships with school and community leaders and understand the difference of poverty versus neglect. Um, just because a child isn't eating or hygiene isn't up to par doesn't often always mean that they're being neglected. You have to take in consideration the family dynamic as a whole. I provided some local telephone numbers for Alabama Department of Human Resources, Jefferson County, Madison, Mobile, and Montgomery County DHR child abuse numbers, so that if you see it, hear it, report it. And I also provided the National Child Abuse Hotline number. Um, this assignment was very interesting to me because I didn't know that there were so many instances where child abuse was more relevant in rural areas. I guess because I grew up in an urban area, I wasn't really familiar, but this assignment definitely showed me that there's a lot more that I have to learn as I progress through this program.